Hello, you're watching Eye on Africa on France 24. I'm James Creedon. A catch up on our headlines this evening from across the continent. The World Health Organization holds a press conference on where things stand with COVID-19 in Africa. We'll talk to one of the participants in today's Think In, Dr. Michel Yao of the WHO. And a special focus tonight on how countries have been faring in the wake of the crisis. We'll get updates from our correspondents in Nigeria and Kenya. Stay tuned for that a bit later on in the show. Thanks for watching now. So far, the coronavirus outbreak in Africa has been much more limited than elsewhere. And while concerns remain that fragile healthcare systems make the continent particularly vulnerable, Africa is still far behind Europe and North America when it comes to the intensity of the crisis. The World Health Organization held a media briefing today on the pandemic and how it's impacting the African continent. James Vizina has more.
Lockdown measures are being eased around the world, but African nations remain alert, fearful of the rising number of infections. 44 countries on the continent can test for the coronavirus, but a shortage of protective equipment is now endangering medical staff. Almost 1,000 health workers have been infected, jeopardizing people's access to care.
And when our frontline workers fall ill or are absent from work, communities don't have access to essential services. We know that to stop the spread of the virus, the key public health measures need to be in place in every community, even where cases have not been reported.
51,000 cases and over 2,000 deaths have been reported so far in Africa. Surprisingly low numbers, which some say could be thanks to the continent's young population, lessons learned from Ebola and stringent measures taken early on. South Africa implemented a nationwide lockdown before reporting its first death from the disease, despite remaining the most affected country on the continent, with a reported 7,800 cases or 152 infections per million people. Its rate, as well as other African countries, is substantially lower when compared to hubs on other continents. But amid these low numbers, cases are rising and fears of underreporting could mean the outbreak is in fact more widespread than we think. And for some, sticking to tight lockdown measures has been impossible. Over half of Africa's urban population lives in makeshift settlements, and many people relying on informal work are unable to stock up on food at home.
They wake up in the morning, go and look for money for the food, and come back, eat their food, then the next day they go and look for their second meal. 87% of them say that they are either skipping a meal or even eating less.
Meanwhile, quarantine for the infected also remains an issue. One survey found that 60% of responders don't have enough space at home to isolate sick people.
Now, for more on that, we're joined by Dr. Michel Yao, who's the Programme Manager for Emergency Response in Africa at the World Health Organization. Thanks for joining us on Eye on Africa. Now, as I understand it, you were present at today's press briefing of the WHO in conjunction with other organisations, taking a look at the overall situation in Africa when it comes to COVID-19. Now, one of the French daily papers here today, Libération, said it quite plainly. The announced catastrophe has not happened in Africa. We were told it would be a cataclysm. It hasn't really happened. You would expect with high density, high populated cities and healthcare systems that are under-resourced that it would have been worse than Europe and North America. That's not the case. What answers were come up with today by the World Health Organization?
Thank you very much. We think that we were very lucky and nobody wished this was a case scenario, because from the modeling, if nothing is done and if we reach a sustained community transmission, then we can have 1 million of cases as well as thousands of people that could be at high risk. What we from our analysis is that the early decision made compared to some of the places could have helped. Mainly the early confinement, closing public places could have helped to at least slow down the spread in many of the countries. So the situation right now is look like 1/3 of the countries are experiencing community transmission, is where you have cluster of cases that are not link at all. And from the modeling, these countries could reach in the next 6 weeks a peak. But they need also to continue to implement public health measures that contribute to slow down the process so that the response capacity is not overwhelmed.
Okay,
but,
so we could still see a
be,
surge. We could still see a surge, and I guess maximum caution ought still to be exercised by Africans across the continent, right?
It is. The high risk is not over yet. Mainly when we move into easing the confinement that is in place right now. Before doing so is to ensure that you have capacity to quickly detect, mainly analyze the trend so that these measures can be put back in place if it's required, even if it's painful and it's affecting many people, as we saw in the reportage.
We don't have a huge amount of time, but there are two specific issues that I would like to discuss with you in the time that we have left. First of all, Madagascar. It's got an awful lot of attention this week. The president of Madagascar has said that he has an alternative remedy derived from the Artemisia plant, which has anti-malarial properties. Now, the African Union has said, let's look into this. And today, I believe the World Health Organization said clinical studies ought to take place. What more can you add to that about this Malagasy solution that could even be rolled out across West Africa and other countries if the President's desire is met?
What we are saying is that we should be careful just pushing forward this medicine, even if we are all looking for solution for COVID, that is a new disease. But we have to have evidence that show that the medicines has some effectiveness on the disease, and also do not harm the public health of the population. So the efficacy as well as the safety is critical, and you can only have evidence on that if you enter a clinical trial. So it's where we are encouraging African countries that may put forward some of the innovative solutions to do it with the scientific process that can help everybody to analyze the push forward medicines and see if it's effective or not.
Wonderful. And just one quick reaction, please, to the news out of Tanzania this past week, where test kits provided by the African Centre for Disease Control proved faulty. Positive results for goat samples, fruit samples. This undermines confidence, doesn't it, in some of the international solutions being brought to bear. What would you say to that? What reassurances could you provide?
About the laboratory exams, of course, there is a reagent. The reagent distributor where we were quite confident that they are up to standard, but it's required a deep analysis in the lab process. And what we were advising is that we can support providing experts to analyze the process, but it's quite easy to throw out the whole process in a situation where we still have cases, and we have cases that are exported from Tanzania in some of the neighboring countries. So we have to be careful and see how we can put in place evidence-based public health measure that could be effective to control this outbreak.
Dr. Michel Yao, Programme Manager for Emergency Response in Africa at the World Health Organization, thanks for talking to us on Eye on Africa. Now, the intensity of the crisis has varied massively across the continent. So let's get a catch-up now on the situation in Nigeria. Here's Sam Olakoya.
Nigeria is an important country as far as the COVID-19 pandemic is concerned. We're talking of a country with a population of more than 200 million people. If Nigeria were to have the same level of infection as we've seen in countries like Spain, the United States, and Italy, Nigeria will be talking of an infection level that will run into hundreds of thousands. But for now, the good news is that Nigeria has 3,000 cases, and we've recorded 103 deaths. But the bad news is that the infection is rising very rapidly We are seeing infection in poor neighborhoods. We are seeing infections even amongst street children. And this is quite disturbing. This trend tends to show that the level of infection might rise sooner or later. We're also seeing infections amongst medical workers, which is quite disturbing because Nigeria doesn't have a strong medical force, and if you have many of your medical workers going ill, then you might have problems treating the large number of people who are falling ill. So this is a trend in Nigeria, and many are hoping and praying, of course, that we wouldn't have that level where we shall be talking of infection that runs into hundreds of thousands.
Sam Olukoya there. And crossing now to East Africa and the situation in Kenya. Here's our correspondent there.
COVID-19 cases in Kenya rose to over 600 today after 25 more people tested positive for the virus. In the past month or so, cases have been rising steadily in Kenya. However, in the past week, it does seem that there's been a sharp rise of cases discovered per day. Twice this week, cases per day have surpassed 40. Yesterday, the government announced specific restrictions at specific areas, like an area in central Nairobi called Eastleigh, or otherwise known as Little Mogadishu. Now, the area is a business hub full of people, and when the government announced the cessation of movement, meaning no people going in and no people going out, there was sort of a mass exodus as people fled to neighboring areas where they might stay with relatives. This is understandable, as also the Population Council of Kenya in a recent report discovered that while in the beginning people adhered to the prevention measures, it's become more difficult as people are having to skip meals because of loss of income, because of not being able to move around in order to find jobs. And so the pandemic here in Kenya is having a huge socioeconomic impact on people's lives in that they are not able to meet their daily needs like meals. And this is also having a further effect on their health.
All right, that's it for this edition. We'll leave you with some images of strength in adversity as Africans help one another to withstand COVID-related difficulties. Here are some pictures of acts of kindness from different corners of the continent. Thanks for watching and good night.